Hi, I'm Sanna and I am a registered nutritional therapist.
Hi, my name's Dr. Emma Williams and I'm a GP and have an interest in lifestyle medicine. Sanna and I have decided we'd talk about Irritable Bowel Syndrome, also known as IBS, which is a group of gut symptoms which is chronic, relapsing or remitting condition, but it's a diagnosis of exclusion. So it's important that you don't self-diagnose and that it is made by a healthcare professional, as we need to exclude other important diagnoses too.
Absolutely, absolutely. That is so important to get that diagnosis before you go and seek any further help. Um, so, for me, when I do see clients with IBS, one of the first things I look at is their stress levels. Stress is a major factor in IBS because your digestion shuts down during stressful times, and when that happens, the digestive juices don't do their job properly. And then that leaves undigested foods in your gut, and that irritates your gut lining. So that's the first thing that I would look to address. There are common foods as well. There are quite a few common foods that are triggers for IBS symptoms. Some of them is gluten, wheat, dairy from animal sources, refined carbs. So that's actually white foods that are full of refined sugar. Things like coffee, alcohol, tea, and sometimes citrus foods as well, but also FODMAPs.
Yeah, I think it's really important to have like a food diary to look at. So sometimes people notice that certain foods are their trigger, but everyone is different. Everyone's got a different gut biota. So it's not one size fits all. And as I said, before you exclude things, or if you do notice one food is a particular trigger, that sometimes it is important to, before you exclude it, to let your doctor know, because we need to test for things like celiacs. And if you've already excluded gluten from your diet, you may get a false negative result.
Absolutely. I mean, for some clients, I would say increase your pre and probiotic amounts of food. But things like prebiotic food, onions, garlic, they are actually FODMAPs, so they could irritate your gut or cause the symptoms.
But we have this one here, but not that I have a bit of
Sauerkraut.
interest in it, a sauerkraut, which is a low FODMAP, which is also a probiotic, which can be of help.
Sauerkraut's great, absolutely fantastic. Same as kimchi. That's a slightly spicier version of sauerkraut. But yeah, that's a great pre and probiotic food if you do like the taste. But as you say, it's so individualized. People's symptoms are so individualized. Everyone's gut microbiome is so individual. So what will work for someone won't work for someone else. But I think like you said, one of the main things you can do is to keep that food symptom diary. Know your triggers, get to know them, because sometimes you can eat a food today, yet your body reacts to it 72 hours later. So it's not always on the day. It's not an instant reaction. Your body takes time to react, and it's just the way the body works.
And I think we talked about probiotics and prebiotics in food. Lots of people ask me about supplements, about probiotic supplements. And I think the studies are all very varied. And as Sanna said, there is no one thing that we can prescribe or suggest. So, and what works for someone may not work for someone else, but generally they can be safe and effective. And it's just trialing them, and it may or may not work for you.
Absolutely. So to, I think, recap, get to know your triggers, keep that food symptom diary, prioritize relaxation, reduce your stress levels as much as you possibly can. But above all, go and see your doctor to get a diagnosis if you do feel that it is something that you do have.
We are still around during the crisis, doing video consultations and things, especially if you do have anything like bleeding from your back passage or unintentional weight loss or anything like that. We do want to hear from you and make sure you're well.
Absolutely. Brilliant. Thank you very much.
Thank you.